Doctor, my relative is undergoing chemotherapy for lung cancer treatment. Could you please tell me how many rounds of chemotherapy will he require to treat this lung cancer?
So when a patient comes to medical oncologist, when we explain to them about the chemotherapy and all, one of the first thing they ask is how many cycles of chemotherapy you may require. How many cycles of chemotherapy is basically depends on what situation you are treating into. Like for example, in a patient with a curative intent, whether if you are giving with radiation or if you are giving after the surgery, in such situation usually the rounds of chemotherapy usually is going to be 4 to 6 cycles that you usually give in once in 3 weeks, 4 to 6 cycles. Whereas in palliative setting, in advanced setting, the lines of chemotherapy or rounds of chemotherapy we usually give as long as the patient tolerates or patient develops for major side effects because of chemotherapy. So the number of cycles of chemotherapy and the duration is going to depend on patient fitness, in what situation you are going, whether if you are giving in a curative intent, whether you are giving in a palliative intent, how fit is the patient and what is the patient comorbidity. So based on all those things we decide on the number of cycles and chemotherapy. So it's basically like a individualized. So majorly or generally in a curative intent we will give 4 to 6 cycles of chemotherapy, whereas in palliative or advanced lung cancer we may have to give chemotherapy as long as the patient responds or as long as the patient tolerates the chemotherapy. So the number of cycles will basically depend on these two factors when you treat the patient with lung cancer.